One of the myths I like to try to dispel about plastic surgery is that like a lot of people, and me one of them, right? Like I thought it was about vain people, right? You know, rich people that just cared about themselves and what they look like and, you know, trying to keep up with the Kardashians. But the more I do this, the more I realize that plastic surgery is very, very infrequently about vanity. Plastic surgery is usually about someone who is very uncomfortable and very self-conscious about themselves. There's something about themselves that they don't like. And I think it's a very challenging thing because for better or worse, we still largely define ourselves by what we see in the mirror. And if you don't like that, what you see, or there's something, you know, that is weighing on your mind that makes you self-conscious, it's a very difficult thing to then approach the world with any type of positivity, right?
It's still his, I don't miss it. It's go, 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 like a go-go flow. And I'm almost done, and I told you so. When I throw these flows, like it's Rochambeau, and I ain't too close to the Joe Smo goes. And I'm on my grind, that is all the time. I do not do breaks, that's right, I stay in dry. And look, I'm back with a little bit of that, and a little more cash than it came in with. Ready, that cat is out that bag, but I still ask you, the boy got skills. I don't need her, I don't need him, I don't need help with me, I got this. I can sing songs, I can spit raps, and I can do both, even do this, word.
This episode is brought to you by Sweat Tent, the pioneers of the portable wood-burning sauna. Did you know that using the sauna 3 to 4 times per week could reduce your risk of cardiovascular disease by up to 50% and make you 60% less likely to experience Alzheimer's disease? That's why I've been a big fan of the sauna for years. But having to go to a crowded gym to do it isn't ideal. And all the at-home options are bulky and expensive. That's why I only use the Sweat Tent for my sauna needs. It's the most storable and affordable wood-burning sauna on the market. It not only takes minutes to set up, but it can reach 200 degrees Fahrenheit in 30 minutes or less. So whether you're enjoying it yourself in your backyard, with friends, or in need of a reliable sauna on the go, Sweat Tent is your best choice for the most portable, storable, and enjoyable outdoor sauna experience. All On The Stacks listeners will receive $100 off when you use code OTS. Visit sweattent.com today to get $100 off your purchase with code OTS at checkout. Again, that's sweattent.com to get $100 off with code OTS. Sweat Tent, helping you fire up your home wellness routine. This episode is brought to you by Burn, the fitness company behind the Today Show approved Burn Board. If I'm being honest, working out can be a real chore, especially as a new dad in desperate need of sleep and cardio. Burn is founded by NEPA native Jimmy T. Martin, and his Burn Board offers a low-impact core and cardio experience unlike anything I've done before. They have hundreds of on-demand workouts that are great for beginners, seasoned athletes, and out-of-shape podcast hosts who love supporting small businesses. My wife and I use it pretty frequently throughout the week, and it's honestly a great way to burn a ton of calories without burning a ton of cash. Not to mention, it's a great tool for skiers, runners, wrestlers, and hockey players. Jimmy is offering all On The Stacks listeners 15% off when they use the code STACKS15. Visit theburn.com today to get 15% off your purchase with code STACKS15 at checkout. Again, that's theburn, THEBRRN.com to get 15% off your purchase with code STACKS15. It's time to get on board today with Burn. What's up, podcast? It's your host, Bill Corcoran Jr. here in the Blue Door Studio, protected by Ritchie Security Solutions. Dr. Chris Sanders, welcome to the On The Stacks podcast.
Thanks for having me, man. Good to be here.
Yeah, I'm excited. But first things first, I mean, who does your hair?
I do it myself.
Do you?
Yeah.
Because this is like, you got like, I mean, I'm jealous.
Thanks.
I
hear that a lot. Yeah, I'll tell you the secret.
Yeah, what is the secret?
Suave hairspray.
That's it.
That's it.
That's it.
That's the secret.
Who cuts it though?
So actually, Crystal is a girl at Sapphire that out in Pittston. She does a real good job.
Obviously, yeah. She's crushing the hair game.
Yeah, thanks, man. Yeah, and she, I like her because first of all, she told me I had Jon Snow hair, which I'm sold. I'm a client for life.
Wow.
You know, so.
Yeah,
So I'll take that.
I see it now too.
Yeah.
I feel like you even kind of look like him.
I'll take it.
Wow.
Yeah.
Wow, that's now I'm never gonna forget from here on out. Every time I see your face, I'm just gonna think. That's what I'm gonna think.
Yeah, winter is coming.
Yeah, and it is. But you're also one too who like you look exactly like your headshot, which is like rare, right? Like most days now. Obviously, sometimes headshots depends on how recent you have them. But like we've never met in person. I've only just known who you were, and I see your picture online, right? Your headshot, and it's like professional headshot. Usually, like when you see someone in person, you're like, wait, is that who I saw online? You know what I mean?
Yeah, as advertised.
The hair is still like really, really fly looking.
Yeah, thanks, man.
But yeah, man, I'm impressed with the
I appreciate that. Thank you.
That's why I wear the hat, because I don't have impressive hair like most people.
Well,
So
the problem is, this is literally a can of hairspray's worth of product, right? But then the problem is once it gets out of control, there's no going back.
I was gonna say, yeah, I'm sure. It's the hairspray is just holding the whole thing together.
That's right.
Keeping it all together, But all right, well now we got the hair tip in here, but I thought maybe we could start off with a little guitar solo or something. But,
yeah, I don't have you don't have anything. With
I know, yeah.
I didn't come prepared.
That's all right. But you're a big music guy.
I am. Yep.
And we were chatting before with Eric, the producer of the show, and you guys were were talking about guitars and things. I had no idea what you guys were talking about, but yeah, man, you're a big musician.
I like to think so.
Yeah.
At least I have. I consider. I pretend to be a rock star. I pretend to be a musician when I'm downstairs in my basement rocking out.
Right.
Keeping my kids up and driving my wife insane. But no, music's. It's always been something I've loved since. And I think my mom actually had a lot to do with that. My mom. I always say she was like. Tori Amos growing up. She played piano and the organ at church and flute and violin and all this kind of stuff. So music's always been sort of a big part of my life. I took piano lessons for 8 years and probably can't play chopsticks now if you ask, but like to play guitar. And that's my thing. That's what I like to do. One of my vices, we were talking, before about my, guitar pedal addiction. But yeah, I love it. It helps, de-stress. It helps. I always say playing guitar is, mindless and mindful, I guess, if that's, the buzzword. So helps me, stay centered. And one of the things I like to do and as much as I can in my spare time, what I have of it.
Yeah. So you said you growing up, it was like your mom kind of like influenced you, like got you into music?
Yeah, I think so. Now, her version of music isn't my current bag, right? Like she was more like James Taylor type stuff. But again, I'm more of a hard rock, heavy metal sort of guy. But yeah, I think, my grandmother too, she played piano. So it's always sort of been, in the background and something that, I always loved. I, grew up in the 80s listening to, hair metal and, all that kind of stuff. So,
you still got the rock star hair.
Yeah, that's right. Right? Like you tease it out a little bit.
Yeah. Do you on the weekend sometimes in the basement?
Sometimes I'll go for it. I'll
crazy.
Put the spandex on.
Yeah, right. Yeah, two cans of hairspray maybe.
That's right.
Not just one.
Like I said, suave, totally 80s, man. It works.
That's funny. Yeah. So I think it's kind of interesting because you talked about your mom and then your grandmother, right? Like, and I think a lot of times, I'm not, I told you right before we started how bad I am musically. Like, I love music. I love listening to music. I love everything about music. It's just, I'm not like, I can't play instruments. I mean, maybe if I tried, but I never really told you the extent of my musical career was maybe when I was like 10 years old playing the recorder. Yeah. I think that everybody had to play, like, I think as a kid, played the song "My Heart Will Go On" or whatever, and I rocked it out really, really, really hard, music class as a fourth grader or whatever. Right. But that was it, man. And but I just have a great appreciation for people that have the talent, to be able to play music. And I just thought it's kind of interesting, like with your family, like it kind of like has passed down from like generations, like as far back, as you can remember, to your grandmother. I don't know if you have anything further back, but to me, it's just interesting because, like, talents and things like that, I recognize a lot that kind of go back generations in families. Like, it kind of sort of just, I don't know if it's the talent passing down, but also just, the influence of...
And exposure.
The exposure.
Just being around and just having it be like a normal part of your existence.
Yeah.
But yeah, and it's something that, I've tried. So my youngest son, Reed, my older son, Jack, he's not, he's not too much into music, but my younger son, I try to get him to listen to the stuff that I listen to. And one of his favorite bands, he actually likes the band Ghost. I don't know if you've heard of it, but they're like, pop metal, I guess. But I was explaining to him the different like genres of music, right? And he was one day, because he knows I like rock and roll, so he wants to be like Dad, I guess, And so he likes rock and roll. But then he thought like if you like rock and roll, you have to like all of it. So we're driving down the road and I forget what we're listening to, but like an acoustic song came on. He was like, "Daddy, is this rock and roll?" And I'm like, well, yeah, it's rock. And he's like, I don't think I like this. I'm like, it's all right, man. Like, you don't have to like it all. Like, you can pick and choose, But it's something that I've, tried to pass on to my kids too. Cause I just think it's, to me, again, this is, music it's kind of like, I've always said it's the language of life, right? So like, it's about being alive, and it helps you process whatever you need to process in that moment, right? So like, if you're angry, you're sad, you're in love, you broke up, right? You can basically find
every
a song,
emotion,
right? You can find a song, and it's something that I really enjoy, and like playing and keeping it part of my life.
Yeah, I was gonna say that there's probably not like one person. Did you ever meet a person that doesn't like music?
If I had, they're weird,
right?
Sorry.
I think it's almost impossible.
It is almost impossible,
right?
Yeah,
it is, because like kind of like how you just said, like and I said too, you can find like every emotion, right? There's something for everybody. And the other interesting thing I like about music is you can interpret a song and or lyrics one way, and 100 or 1,000 other people can interpret it 100 or 1,000 other ways, which is also like just so fascinating when you really like think about it.
Yeah.
Because like you hear, I'm big on just like lyrics and just like really like, but again, like when you hear a song that you connect to, you obviously have your own interpretation, and a lot of times the artists, the musicians don't ever really reveal like really what it means, but they purposely leave it open for interpretation, which is also kind of cool and fascinating.
Yeah.
But I always just like that stuff just intrigues me, because like I said, like I don't think I've ever met a person that's like, you know what, I just don't like music.
Right.
Like how could you not?
Yeah.
Yeah.
It's
like, and like you said, if you are, I think you're just like a weirdo.
Yeah. And it's, it's something that beyond sort of going what we were saying with like your interpretation of it, it's like I always say we bookmark our lives to music, right? So like, when you're born, we celebrate it by singing a song, right? When you get married, you come to the church with a song. You first dance to a song. Like, we get funeral
everything.
Songs. Funerals have songs, right? But like I always say, think of the best time you've ever had in your entire life. Like, there's probably a song playing, right? Or if not, there's probably a song that reminds you of the best time you've had in your life. So like,
definitely.
And I think it's that connection that we have, even beyond like the actual interpretation and meaning of a song. Like, it can mean something far beyond what the melody and the lyrics say to an individual person.
Goes you can go down a lot of rabbit holes.
Yeah,
you really could.
Oh yeah,
like we could just do this whole episode about music.
Right, we could. Hey,
Yeah. So as a kid, like, did you ever play like in a band or anything, or were you always just like?
Yeah, no. So so I played, and this is something that people, when I tell them this, they love it, right? But like, I played in a band called Neck Brace. We played a lot of hard rock, heavy metal sort of stuff. I was the guitarist and lead singer of the band Neck Brace. The reason we were called Neck Brace is because we said that we were so heavy, you would need a neck brace by the end of one of our shows.
I get it.
Break your neck from headbanging, right?
Yeah.
So like, and it was a lot of fun, and it was something that we really enjoyed growing up, and we kind of had like a shtick, like we were very tongue in cheek, so to speak. Like, our bit was, we thought we were the biggest and best rock band in the world, but we were like playing out of my grandmother's garage.
Yeah.
Yeah. And but yeah, and we played together for a couple years in high school. Had a couple shows out of my grandmother's garage. It was 2001 A Brace Odyssey, which was probably our biggest show. We had my driveway packed with at least dozens of people. But no, we had a lot of fun doing it. And, one of the things is one of my friends was he was into film and all that kind of stuff. So one of his projects was actually to make a documentary of our band, which is out there. It'll if it's, I almost don't want to encourage people to look for it too much, because I'll probably get canceled, some of the stuff that was in it, but, it was a lot of fun doing it. And we always said, like, it'd be like the 25th anniversary, in the age of reboots and remakes and all this kind of stuff. Why not do, Where Are They Now? 20 years later.
Yeah, bring it back.
Yeah. But it was a lot of fun.
Yeah.
And some of the guys that I played with, like our lead guitarist, pretty talented. I mean, we were tongue in cheek, but I think we were pretty decent musicians. One of the guys that I played with actually ended up going to Berklee School of Music and played guitar and made a career out of it for a little bit.
Nice.
So yeah.
Do you still keep in touch with some of them?
Some of them, yeah. Yeah, not as much as I would like, but I think it would be one of those things like, hey, like in the movie montage going around, let's get the band back together. You know what I mean? Like where we all are at in life, you know?
Yeah, maybe, the new name would be, I can't think of a creative spin on it, but something to do with, plastic surgery.
Right. Yeah, we could think of something.
Yeah.
Like face transplant.
Yeah, there you go. Yeah, V2, you know?
Yeah, right.
Yeah, V2 of the face transplant. There you go. Jeez, you're more creative than me. I think you should be on the other side of this.
Well, I mean, this is the stuff that keeps me up at night.
Yeah.
You know, this is what I think about.
Thinking of new band names,
Right.
reboots.
Yeah, exactly.
Yeah. So what really got you into the medical world in general? Let's just kind of want to start there.
Yeah. So, there is, again, so my family, I think there's two versions of what got me into medicine, and I think they're both equally true. My mom was a nurse, so she was kind of just always grew up around other nurses and doctors, and they were family friends, and there was that aspect of it. And then the version my grandmother would always tell is that my grandfather, who he lived with when my parents were just getting their feet under them, graduated from college, getting their new jobs, they were actually building their house the way we always called it, the Sanders compound, right? So like my grandparents had a house with a pretty nice chunk of land. And then my parents ended up, buying half of that land. So like our backyards, they were basically adjoining, right?
Yeah.
So when my house was getting built, we actually lived with my grandparents for, a good number of years. And my grandfather was very badly wounded in World War II. And, he needed towards the end of his life, he was pretty sick and needed like chest physiotherapy and oxygen and I remember, pounding on his chest, to help get him like the phlegm and all that kind of stuff up. And he always used to call me his little doc. Right. So, and my grandmother says from that point on, I always knew you were going to be a doctor. So she says it was because of that you ended up going into medicine. And I don't know if it's true, but I think it's a good story.
Wow. Yeah. That is interesting.
Yeah.
Yeah. So tell me more about your grandfather and his, you said he was badly wounded in the war.
Yeah. So, it's, greatest generation, right? They don't make them like they used to. Right. So it's a story that I really like telling because I think it speaks a lot, and one of the things that we've said before is people ask where you're from. I think a lot of that we say geographically where we're from, but I like to say I'm from my family, right? And my grandfather's story I think is something that I'm proud of, and I think a lot of people have a story like this, and I think it's the American dream, right? So my grandfather was orphaned at a very, very young age. And we were talking, 20s and 30s sort of thing. And it was him and his older brother. And they were from West Virginia. This is, around Prohibition sort of time. And they were homeless, not had it rough. They did not have a home to go to, like not a roof over their heads. So they're trying to figure out how to make ends meet. And they end up falling in with bootleggers, and so they started running moonshine, back in the day. And my grandfather always told the story, when we asked him, because he ended up in the military at a very young age, and we would ask him, you're 16 years old, how did you wind up in the military? And he's like, well, the rules were a little bit less back then, but he would always tell us I had it rough, and ended up having to make a choice between either going to jail or going to the military. And we always used to figure like he just meant, I was going to have to start stealing, to make ends meet, or, where my next meal would come from. But what we ended up finding out that was actually literally true, right? Because he ends up running moonshine. They get caught. His older brother ends up going to jail. And this is, we find this out years later, right? So older brother ends up going to jail. My grandfather, who's, maybe 13, 14 years old at the time, ends up breaking him out of prison, right?
Prison break.
Yeah. Right. And gets in a stolen car, right?
Even better.
And they're driving around, and I imagine the old timey music playing and like the cops chasing him, and he's, driving, can't see over the dashboard, ends up getting in a car wreck, and thank God no one was hurt, because I don't know how fast cars went back then. Right. But ends up getting a car wreck in a stolen car after he broke his brother out from prison. And they end up giving that's the point when they said, hey, listen, this is your choice, right? You can either join the military, get your life straightened out, or you can go to jail. And my grandfather chose, well, I think this is a good time to get my life straightened around. So he ended up choosing going in the military. His older brother ends up bugging off to Canada and never heard from again, right? So my grandfather ends up in the military and does very well for himself and ends up, having a good career and sort of rising through the ranks as much as he can as an enlisted kid, right?
Yeah.
And ends up actually becoming a drill sergeant at like the age of 16 or 17, and now the problem is this is, 1940s America, in the military, as we know what's coming on the horizon. So he ends up training, guys who are twice his age to go over fight in Europe, and ends up actually making a decision. He's like, I could in good conscience stay here and send these guys over and, not do my part. So he ends up going over to World War II and it ends up fighting the Battle of the Bulge and takes a mortar shell directly to his abdomen. And, the way he tells it, he's like, it blew my intestines out all over the floor of the woods. And as he's sitting there laying, trying to, pack his, guts back into his abdomen. And he always said, like, the only thing that I thought would save my life was that it was cold, right? So I figure I'll, pack snow on my guts and it'll help stop the bleeding. As he's doing that, a German soldier comes over and bayonets him in the chest, misses his heart by, probably a couple centimeters, but collapses his lung. And he's in a bad spot, needless to say. And back then, what would happen is, it's kind of an unspoken thing that, once the medics saw someone that was that badly injured, they would come along and just, give them basically what was a lethal dose of morphine, with the intent of, getting them out of pain, but knowing that you're not going to, they're
probably not going to
right?
survive that. Yeah.
And so they all knew this. And so the guy, medic comes over, is trying to give my grandfather a lethal, basically with a lethal dose of morphine. And my grandfather ends up getting in a fight with this guy, right? And he's like, no, I don't want this. I want to live. Like, I want to make it. Mm-hmm. So, not only is it, his guts are kind of blown out all over the ground and he's now has one lung collapse. He's now fighting with his own guy, right? Because he wants to live. Yeah. But long story short, he wanted to survive and ends up, very badly injured, but surviving. And, the reason that I always say that that's relevant to me is because my dad wasn't born yet. This is actually 10 years before my dad was born. Wow. And, but for, just kind of that willpower, no, I want to make it. I want to survive. I want to live. I want to go and have a life. I want to get back home. And, but for that willpower, I want to be here.
Yeah.
So,
yeah.
That's why I say that's kind of where I'm from.
Yeah. And it goes back to the story, like with your grandmother and, saying like, you with your grandfather, like,
right.
You'd be, that's it. He's going to be a doctor. And then
right.
if that's, none of this would happen.
Right. Yeah. And it's, on such a razor's edge of, of existence, right?
Yeah.
Like we all are, in some
yeah.
respects, but, I'm proud of that story. So I like when I get the opportunity to tell it.
Yeah. This is a very, very, very cool story. I love hearing stories like that people know. Because a lot of times, like you said, like you didn't know, like for some time in your life, you like a lot of times you don't hear a lot of these stories like until you get like a lot older, right? Like you said, like you didn't know some of the things, until some point, and you're like, oh my gosh, like we never knew that story. And it's like a lot of times it's just very fascinating to find out these things. Like as we get older and start to, not that you weren't an inquisitive kid, but like a lot of these stories, aren't really told to little kids,
right?
As you're growing up,
right.
And you start to find out this stuff as you get a little bit older, and it's like, oh wow, like that's just a really great story, like but yeah, thanks for sharing that. Yeah. So plastic and reconstructive surgery, like why did you choose that? Like, what was the motivation?
So again, it was sort of a couple things. I think, I always, going into medicine, I always had an idea that I wanted to be a surgeon, just because I've always liked the concept of, working with my hands and in medicine. A lot of the stuff that we do, I feel is it's not a bad thing, but it's kind of indirect results. Whereas a surgeon, you sort of get to be directly, be involved directly in the result. Never knew what kind of surgeon I wanted to be. In fact, it's funny. I think one of the things that I knew, or I thought I knew, I didn't want to do was plastic surgery. And that's because I really kind of had no idea what plastic surgery was really all about. I sort of had, the concept of, it's vain rich people who, want to make themselves look better.
Yeah.
And I think for a lot of people, that's still, the view that we have of plastic surgery. So it's one of the things I thought I didn't want to do. But when I was in med school, I went to Temple and I did my general surgery rotations at St. Luke's, where I work now. And back then, I guess this is where I start to feel like an old guy, right? But we didn't do anything electronically, or we did very little electronically. I'm not the best at paperwork, so
Paperwork sucks. By the way, like I don't care what profession you're in, like all paperwork.
Yeah,
sucks.
it's terrible.
It just sucks.
It's terrible.
Yeah.
But we got an elective, so we got to pick, a couple months or a couple weeks out of our rotation where, we got to experience like a subspecialty in surgery. And I think like any guy that decides he wants to do surgery, at some point I thought I wanted to be an orthopedic surgeon. But the problem is I kind of waited till like the last second to hand my paperwork in. They're like, nope, sorry, you can't do it. It's full. I'm like, okay, well, I guess maybe I want to be a heart surgeon. So I handed in, like, nope, sorry, that's full too. So then at that point I was literally going down the alphabet, like A, anesthesia, because that was part of the options. And they're like, nope, can't do that. And I'm like, how about ENT? Nope.
Yeah.
And it literally, I got to the end of the alphabet. It was P for plastics or U for urology. And I was like, well, I guess I'll do plastics, right? Plastic surgery. And they set me up with a guy by the name of Dr. Salgado, who's, an interesting character in and of himself. Like, we used to call him the Godfather because he kind of looked like Brando, but he also was one of the, very first plastic surgeons in the area in the Lehigh Valley, and one of the first and only plastic surgeons for a long, long time. So, the guy was, just kind of seen it all and been there and
like
done
a
it all.
pioneer of the industry.
Yeah. And when I got there, and he was just a cool guy. Like I felt like he knew a little bit about everything, and he was like a chef on the side, and like just had a lot of cool interests. And he, but what would happen? He was a little bit older, and he was, sort of phasing out like his career. But I, of course, I didn't really realize that. But so I would go on the rotation. And it'd be like 10 o'clock in the morning. He would like roll up in his convertible Mercedes. We'd see a couple patients. He'd be like, all right, man, let's go hit the driving range. I'm like, plastic surgery.
I could do this.
Yeah. I can get on board.
Yeah.
But, the thing that sort of struck me that his practice, even though he was kind of winding down, was just sort of the breadth of stuff that he did. One day we might be seeing, a cosmetic patient. The next day he was taking care of, a cancer patient. And by the end of the rotation, I told him, I was like, hey, man, I really like this. This is first of all, not at all what I thought it was. And number two, I like what it is. And he told me, he's like, well, Chris, my practice isn't really indicative of what plastic surgery really is, because I'm phasing out. I'm an old timer. Like, I'm very selective on the stuff that I do. If you really are interested, when you go back down to Temple, go back down, spend a month on their plastic surgery service, and then you'll find out whether you like it or not. So that's what I did. When I became a fourth year med student, the first elective did my paperwork on time this time. I got in to do plastic surgery. And one of the first cases, actually to this day, that month that I spent was one of the most challenging, difficult, busiest months that I had ever seen or known. Much different than, 10 to 1 in the driving range, right? But one of the first surgeries I saw was, an unfortunate guy who, was basically a suicide survivor. And we needed to reconstruct his jaw, his mandible, essentially. So what the surgeons did is they took part of his leg bone with the little teeny tiny microscopic blood vessels and made a jawbone out of it and reattached it to the little teeny tiny microscopic blood vessels in his head, in his neck. And that was something that I didn't even know was possible I didn't even know a human could do that to somebody. But it sort of changed my life. And that was the surgery that kind of was like, wow, I have to do this, and at that point it was like, I don't know that I could do anything else. Once I sort of saw that and saw, how incredible it was and how much it benefited that guy. And, just from a surgical aspect of it, it was mind blowing that was something that was possible.
Yeah. So, kind of like you said, you don't realize what actually, you're doing. A lot of times, you just, like you said, with the first doctor, you're like, this isn't, this doesn't really look like, it wasn't a true representation of really what you could or would do.
Right.
And then as soon as you got that experience, it just clicked.
Yeah.
Right. Like you just like, wow, like this is fascinating.
Yeah.
You know?
Yeah.
And you just like really just took to that, and you were like, you know, because also I think too, like you had mentioned, like we talked the other day, you said like, you know, there's so much more into it, like cancer patients and things like that. Like what all goes into like that? Like what are some other, you know, surgeries like maybe early on that you experienced that you're like, wow, like this is, you know, I know you at this point you're already decided what you want to do.
Right.
But do you have any other, you know, instances or stories like that?
Yeah. So, you know, I think, and again, one of so I do a lot of what we call microsurgery, and that is an aspect of plastic surgery that I think a lot of people don't understand, or maybe not that they don't understand, they just don't necessarily know that it exists. And
This is new to me.
yeah, so and what that is it's basically like transplant surgery, except you're using your own tissue, and you take like these little teeny tiny microscopic blood vessels that are about, you know, a millimeter and a half or so sometimes in diameter, and you put them together, and you can do that when you have, you know, basically what we call a soft tissue defect or tissue loss. And the reason that becomes the realm of plastic surgery is, you know, you have people with, you know, cancers that are in, you know, I always call it high-end real estate, like, you know, head and neck, areas that are very, you know, sensitive from both a form and function standpoint. And that's really, you know, plastic surgery, we always say we don't really, you know, a lot of surgical specialties are defined by the anatomic area that they operate in. You know, if a colorectal surgeon does, you know, they operate on colons, right? Whereas plastic surgery, we don't have necessarily a defined like anatomic area. We say we're the specialty of form and function, wherever that might be, right? And so I was lucky enough again to be able to witness some of those surgeries by, you know, some sort of heavy hitters in plastic surgery. A guy by the name of Jeff Halleck, who still practices actually down in the Lehigh Valley, is one of these guys that kind of low key has been very influential in plastic surgery over the past, you know, 30 years. He's one of the, you know, literally one of the masters. And I was lucky enough to be able to see him do some of these operations. And then I was lucky enough when I ended up doing my plastic surgery training, I was lucky enough to see or to go to LSU, where a lot of these procedures for breast reconstruction, that sort of stuff, were actually invented.
Oh, wow.
Yeah, so I was lucky enough to work with a guy by the name of Bob Allen and Charles Dupin. That's how you say it in New Orleans.
Only in New Orleans?
Only in New Orleans. Everywhere else is Dupin, right? But but these were the guys that literally kind of wrote the book on how to perform a lot of this, you know, microsurgical, what we call microsurgical breast reconstruction. And it is now, you know, what's considered, I think, the gold standard of what we call tissue-based reconstruction, which is using, you know, your own tissue instead of using, you know, things like implants and that sort of thing. So I was really lucky enough to be able to train with those guys. And again, I was just sort of blown away by, you know, the ability to, you know, technically take vessels that you can't even see without using a microscope and, you know, suture or stitches that, like, if you would pick it up and sort of let it go, it would kind of like blow away with the wind. Like, that's how like little it is. And you can't even, you know, really see it with the naked eye. And that was the aspect, again, of plastic surgery. I didn't even know that was a thing, but lucky enough to realize that was a thing. And that was sort of what put the hook in me.
So you really learned from some of the best, like,
yeah.
And you got like incredible, talk about timing, you know, right? Like, yeah. you got like a hell of an experience, like right off the bat, like, yeah, learning for some of these people. And man, talk about, you know, being able to benefit, you know, your ability to, right, you know, as you're entering this, you know, and entering into this career.
Yeah.
Wow.
Yeah.
It's fascinating.
I've been lucky.
Yeah. Yeah. So, you know, the difference between, you know, I know there's a lot of misconceptions, right? In you know, there's cosmetic, and there's, you know, people who have certain licenses that don't actually apply. And I don't want to use the wrong words, so I'll let you kind of talk about it. But right, you know, there's some maybe doctors you don't want to go to, kind of sort of thing, right? So right, I'll let you kind of talk about it.
Yeah. So, you know, one of the things I think that's really important for people to understand is one of the things that was, sort of shocking to me, sort of going through this journey and learning, about plastic surgery and aesthetic surgery, is that there is a significant portion of what we consider, cosmetic or aesthetic surgery. I like saying aesthetic surgery because to me, cosmetic is something that covers something up. Aesthetic is like an ideal of beauty. That's my nerd thing. But, so a large portion of, cosmetic or aesthetic surgery in this country is not performed by plastic surgeons. It's performed by people who label themselves as cosmetic surgeons, and that's not a thing, right? There is something called the American Board of Medical Specialties that sort of recognizes, they're the people that basically come up and say, like, cardiology is a specialty, plastic surgery is a specialty, trauma surgery is a specialty. They're the people that make those decisions, and it's a regulatory board, and it has strict criteria of what kind of training you need, what that training looks like, what the board certification process is, and you will not find cosmetic surgery as one of those things. What cosmetic surgery is, there's this thing called the Board of Cosmetic Surgery, which is not part of that regulatory process or regulatory board. And it's a patient safety issue and why these things exist. But these people are doctors who go and, they can pay, $1,500 or however much it is and go to a course from the American Board of Cosmetic Surgery and, go to Las Vegas and have a 3-day course and then come out and say they're cosmetic surgeons. And they might not even necessarily be a surgeon, right? They might be, a family practice doctor or, someone that doesn't have surgery credentials. And I'm not saying that there's anything wrong with those specialties. I'm saying that these people who portray themselves as something that they're not, right?
Yeah, it's a little scary.
It is scary. It's very scary. And these days, patients are, I think, smart and savvy enough to say, like, they understand that board certification is a thing. But then these people say, when they ask the question, are you board certified? Well, yeah, here's my board certification.
Yeah, Jared told me to ask you. If you're board certified.
I am. Yes, I am. It took a while, right? Because it takes a while because it's an important process.
Yeah,
and it's important to make sure that you're safe and ethical and you have gone through the rigorous training that you need to do these procedures. And some people bypass that process, but patients don't understand the difference because they think, yeah, this guy said he's board certified in cosmetic surgery. So
of course, you trust the doctor, right? It's like, you look at, it's like, again, for people that don't know a lot about, the medical world, it's like you're going into a doctor's office, doesn't matter what specialty, whatever, it doesn't matter. Like most times, the average person, you go in, it's like, it's a little bit intimidating, for whatever reason you're there, no matter what. It's like, you sometimes you don't know what to ask. Mm-hmm. And, and you're going in like, I don't know, you're just going to trust the doctor. Right. Right. Like what more can you do? Right. Except obviously nowadays, with Google and stuff, you can do, you can do more research and things like that. But like, I'd say the average person would be like fooled so many times by that.
Yeah, and that's the thing that's disturbing, right? Because it's kind of predatory.
Yeah,
right.
Yeah.
And because you sort of, you come to that, as the cosmetic surgeon in a position, like you just said, it's a position of power, right? And people, there's an inherent trust that's built in, the physician-patient relationship, right? And you just assume that your doctor is going to operate in your best interest. That's
sure.
kind of the deal.
Yeah, so right? It should be. Right, yes, I think it's supposed to be like
that's
that,
kind of like the base thing, right? Unfortunately, these people take advantage of that.
It's like shortcuts.
Yeah, it's shortcuts, and it's it's like shortcut, and it's almost like a shortcut to like a different finish line.
Yeah.
Right. And, people take advantage of that, and it's scary, and people should recognize the difference. Right. So, if your surgeon is a cosmetic surgeon, right, the next question you should ask is, are they a plastic surgeon? Right. Or are they board certified by plastic surgery? And that's, I guess that's my public service announcement. Right. Because there are people out there who portray themselves as something that they are not. And that is, you know, it violates like so many things, right? And it sort of pains me to even have to say that that sort of thing exists, but unfortunately it does. And it's very common. And the challenge is, you know, it hurts people, right? And that's the sad thing of it, because it's people hurting people and not doing the right thing for them to make a buck. And that's you know,
Yeah.
That's disgusting.
Yeah.
Right. It is
yeah.
what it is. Like,
yeah. Everyone says that, you know, you could be talking life and death here.
Mm-hmm.
You know, somebody can go in and get an infection and that's it.
Yeah.
You know?
Right.
Like that's scary, you know?
Yeah.
And you hear all these horror stories. And I'm sure you could probably, you know, I'm sure you probably have heard of some or know of some of people like either going out of the country for things like this as well, just to save a little bit of money.
Yeah. And, you know, it's something that, you know, I have seen quite a bit of, you know, honestly, surprisingly, a lot of that happens, you know, in our area. And I don't know that, you know, as necessarily, you know, and it's something that maybe you just never think of happens like
In your backyard,
you know,
yeah.
in your backyard.
Yeah.
But I've had patients, you know, from this area. And, you know, and just seeing patients when I was out in training, you know, I did my training in New Orleans, seeing people go to other countries, you know, to try to save money, right?
Where do they go?
You know, a lot of it is, you know, Mexico is big. The Dominican Republic is big. Now, there are certainly, you know, places like Brazil who have some of the best plastic surgeons in the world, right? But you go to some of these other places and you don't know if that guy's even a doctor,
Yeah.
right?
Yeah.
And I've seen, you know, significant complications from patients going, you know, to another country because that's where their grandmother was from, and they heard of this guy that's in their village, and he's a, you know, plastic surgeon, and, you know, he'll do the surgery for, you know, $2,000 cheaper than you can get it in America. And that's really scary because, again, you know, not, you know, in the United States, we have a lot of, you know, regulatory stuff, but again, it's all in the benefit of the patient, right? To make sure these people are safe. Other countries, you don't have that.
It's like a free-for-all.
It's a free-for-all,
yeah,
right? So
scary.
I remember, you know, one patient, you know, that I saw that went to another country to get a breast augmentation. And she was a patient, you know, that, you know, had a good job, had a family, you know, was a mom of two, and, you know, just and heard about this guy in her, you know, grandparents' village and went to another country and got a breast augmentation. And I'll never forget her because I was on call and I get a call from, you know, one of the, you know, the internists at the hospital. And he's like, you know, we have this lady, she's really, really sick and she's, you know, basically on death's door. And we think her breast implants are causing it. I was like, that doesn't sound right. You know, it's like, cause you can get infections and all that kind of stuff. And that's, you know, certainly a complication that we worry about, but it's typically not like a life and death sort of type thing. So like, all right, well, let me go see her. So I go see the patient. She's in the ICU. You know, her white blood cell count is extremely low, right? Which we all know white blood cell count that's high is bad, but probably even worse is that a white blood cell count that's low. That's because that's saying your body's trying to fight infection so bad it doesn't even have any ammunition left, right?
Yeah,
so,
yeah.
So I go see the patient, and you know, her breast implant is essentially just like, you know, eroding through her skin, and she's sick. She's really sick. And I end up, you know, basically just, you know, taking the implant out. She gets better. And then I'm asking her the story, like, what happened? Like, and she tells me the story that she went to see this guy. He did, you know, breast augmentation on her. She came back to the United States, got infected. She went back to the village, and, you know, he basically in front of her, like, put ice, you know, on her chest for anesthesia, takes the implant out, washes it off in the sink, puts it back in.
Come on.
Right. No, this is a true story. True story. And again, but people don't know. Like, you know, you probably think at this point, like, something's not right here.
Something's wrong.
But maybe, like, people still don't really understand, right? So, so she comes back to the United States, again, gets really sick, goes back to the village. The guy, you know, takes the implant out. This time he puts new ones in, but sends her to a hotel room where she's there for, a week or two, and every couple of hours some other guy would come and inject her with something that she was told was antibiotics.
Something,
yeah. Who knows? And then she ends up coming back to the United States, and as I found her, and that was all to save
a couple thousand
$2,000, right? And
wow.
And it's sad, but this lady almost died, and then she spent the next 6 months of her life wondering, does she have HIV? Like, these are all the things. What is this person injecting? Like, she has some crazy, awful, weird bacteria that that we don't see here in the United States. Like, so not only and then again, like, not only the loss of that patient's, quality of life, but she ended up spending however many thousands of dollars more going back
just
and
the
forth,
travel,
and,
just
being
the travel,
sick, and all that kind of stuff. And when resources are available to them, to patients here in the United States, but that's the scary thing, and we see a lot of it, and people, it's scary. That becomes an option for some people. And I think the scary part is, like, people still hear the horror stories and they still do it.
Yeah. It's like, that won't happen to me.
Right. Yeah. And
that was a fluke. Yeah.
Right.
Like,
and it happens, I can tell you it happens more often than you could ever probably possibly
that's
imagine.
wild. Cause it's like, it's also one of those things I feel like you only like see in a movie.
Right.
You know what I mean? Until
Yeah.
until it either happens to you, God forbid, right?
Yeah.
Or you personally like know somebody really close to you that it's happened to. Like otherwise you don't hear about it. It's just like, that's not real. That doesn't happen.
Yeah.
But it does.
It does.
That's crazy.
Yeah, and it's scary. And again, public service announcement, there's stuff here in the United States, right? Like, and I always tell them, like, so, if people, like when I was in training, like, we had a clinic for patients that, it sounds silly, but who couldn't afford, some plastic surgery services are not cosmetic or aesthetic and are necessary, but people couldn't afford it, right?
Sure.
But there are other things like, we had, for instance, like when we were training, we had a resident clinic where, we as the resident, as the trainee, were kind of the point person, but we always had, a board certified plastic surgeon, right over our shoulder in the surgery with us watching and, helping us perform the surgery for a fraction of the cost of, of what a board certified plastic surgery would be. So it's,
there's still a lot better options.
Right. There are so much better options, but people don't know, unfortunately, sometimes they don't know what options there are and don't know. I don't want to say they don't know better, right? But they don't know what options are available.
Yeah. People just don't know sometimes. And then also kind of like the other thing is like the impact of social media.
Right.
Like you look at social media nowadays and it's, it's a blessing and a curse. I tend to think it's more of a blessing than a curse. I'm on the more I try to be on the more positive side of it, right? But, like there's, the perceptions that people have, like, and you look at like the, also just like, everybody, I'll just name the name Kardashians because that's like this most obvious, I feel like, one that everybody can know and recognize. Like, It's like you look at people like that and it's like, you have social media that's just influencing like younger people and even, not even just younger people, but like just, I mean, all ages, but, obviously younger children, generations like see this online and they think like this is like reality and like, and maybe that's where people fall victim to like, oh, I want to look like her. And the only way I can afford it is to go down there. And it's like, whoa.
Yeah. It's one of the things that, as plastic surgeons, there's like a love-hate relationship with social media.
Yeah,
right?
I'm curious to hear your opinion on this. Yeah,
and just to your point, like it's not even young patients. Like when I mark patients, sometimes I'll tell them, "Give me the Kim Kardashian pose," which is this, right? Okay. And I don't even have to tell them what it is. They hands on the hips, they just do it instinctively, right? And but the love-hate relationship is such that for a lot of people, it's their only exposure to plastic surgery, right? So anytime, there's no such thing as bad publicity, right? Unless there is, right? Yeah. So, I think anything that can be used as a tool to educate people is a good thing, right? To get more information and to get, to know things like, well, what's the difference between, a cosmetic surgeon and a plastic surgeon? So, social media, has been a good tool for people to get that information out there. But, to your point, it's also, I think, very challenging, when we talk about what the ideal of beauty is.
Yeah, that's a hot topic.
And, some of that is, you look at these, so, and a lot of times I'll have patients come in and they'll show me like an Instagram post, or, I'm like, well, number one, that has a filter, right? Number two, that, the angle is, top down.
It's a perfect angle.
Right.
Like, you know how much time they spent.
Exactly, right?
20, 30 minutes to try to get that pose, plus there's a filter, airbrush, the whole bit.
Like it's basically a cartoon character,
pretty much, not real.
Right. But, people look at that and say, well, that's exactly what I want to look like. And, part of the challenge has been, it's a phenomenon that I don't know how to exactly to put my finger on it, but I think back in, I always say like the 80s, right? Like plastic surgery was a status symbol, right? You want it to look, bigger and tighter and
younger,
right? And all of this stuff, because that was like, well, I can afford to get this done, right? And this is, I don't care if I, how I look. I just want you guys to know that I had plastic surgery. And that was the thing, right? That was like, Joan Rivers, right? Like I want everyone to know that I had plastic surgery.
Yep.
And I don't know that it's quite like that today, but like I feel that there is a certain aspect of wanting to look done, right? And maybe it's not with, a super tight facelift, but now it's like a ton of filler, or like, the
lips and the cheeks. And
I saw an article that was fascinating. They called it the alienization of the face, right? Where it's like, you look at, pictures of aliens, right? They have like the, big eyes and like in this very sort of elongated face with like this chin and the cheeks. And I was like, what? I never heard it called that before, but I'm like, yeah, that's actually kind of what it looks like. And it's like, I'm not sure who decided that looked good.
I always look at like, you can tell like when people like have too much, like there is such thing as too much plastic surgery, correct?
Yeah,
right? Okay.
Absolutely.
Okay, I'm not losing my mind.
No.
It's always like you're out, whether you know the person or not, like, and you're looking at somebody, you're like, man, that's too much. Like, why do they think that looks good?
Right. And I think it's because, number one, I think that a lot of people, and this is pure conjecture, right? But a lot of these people might not be getting they might be going to people who are not trained.
So it's not done right.
Right. So it's not done right. And then there's the ideal of, well, I need to, look younger, look bigger. So like I need to get more done.
It's always more. It's almost like an addiction.
An addiction. Yeah.
It's like people just become like,
right. But then that becomes like a self-feeding fire, right? Because, well, if that person looks like that, well, then I have to look like that. Right. And that's what everyone's posting. So this is now sort of stew has become like a new ideal. And like a lot of these things sort of violate, what we would otherwise think is aesthetically pleasing or aesthetically normal. Like a lot of this stuff looks abnormal. And, and it's, to me, it's like people who are, using, pumping people's faces up with, too much filler and too much Botox and too much, in their lips, like they're violating a lot of principles of what we do. It's like, always want to do what's safe, right? And a lot of the stuff, it's not safe, but what if you believe social media, that's what everyone's getting, right? That's what everyone's looking.
So you're like, oh, well, I'm just doing it because that's what everybody's doing.
That's what we do, right?
You just find somebody that's just going to administer that.
Exactly.
Right?
And then if you go to someone like me who says, no, I'm not going to do that.
Yeah.
Well, the problem is someone will, right?
Yeah. Unfortunately.
Right.
Unfortunately. Yeah.
So, again, it's one of these things that, and it's challenging too sometimes, right? As a plastic surgeon, I always say the worst scenario we can ever get into is when I think I hit a home run and the patient thinks I struck out. Right? And a lot of that is because,
On the Stacks will be back in a flash after a word from our sponsor. This episode is brought to you by Elevation Wellness, NEPA's premier wellness center located on Mundy Street in Wilkes-Barre. From pro athletes to busy parents, Elevation Wellness is leading the conversation when it comes to bettering your health through integrative medicine. Founded by NEPA native Louis Helmecke, Elevation Wellness offers physician-formulated and guided treatments that are administered by registered nurses. To learn more about how you can experience the benefits of IV vitamin therapy, multivitamin booster shots, non-invasive aesthetics, or peptide, NAD, red light, and compression therapy, visit elevation-wellness.com or follow them on Instagram at Elevation Wellness NEPA. All On the Stacks listeners will receive 10% off their first purchase with code STACKS at checkout. Call 570-762-9400 or visit elevation-wellness.com to book your appointment today. Elevation Wellness, taking your health to new heights.
A lot of times when people are in car accidents, kind of forget what we should do. First and foremost, call 911. Then, get out of your car before moving it and take pictures. It's so important to capture what the cars look like immediately following the accident. Finally, call your insurance carrier and make a claim.
To learn more, visit Anzalone Law offices online at anzalonelaw.com. And now we're back on the Stacks.
I want it to look like this. And this person looks like this, and I don't look like that. I'm like, well, that's not your face,
Yeah,
right?
That's not normal.
And that's not a good look. And so that becomes a challenge.
Yeah, how do you manage that? Like the expectation versus reality.
Right. And that's, one of the things that, because I do a lot of training with, some of our fellows and residents who are learning plastic surgery, and that's, you hit the nail right on the head. It's always it's managing expectations. And that you have to do up front. Because if you try to manage an expectation afterwards, you've already lost, right?
Yeah, it's over.
It's over, and it's very challenging when, again, when you have a situation where I think I've done great, but the patient's expectation wasn't met. Well, that means I probably did something wrong when I first met the patient. Like I didn't explain to them adequately what the risks are. I didn't explain to them what a realistic, outcome was. And so that's, I always say that that's kind of on me is making sure that I manage that expectation, because if you have that conversation up front and the patient realizes, my butt's going to look better, but it's not going to look like J-Lo, right? So that expectation is like, well, now I'm happy with what I have, not what I don't have or what I got, right?
Right.
But it's a challenge, and that is, one of the things that is, I think sometimes, the cliche is that plastic surgery is an art form, and it is, but I think it is also, the art is not necessarily from a surgical technique standpoint. Sometimes the art is just being able to talk to people and manage the expectation and saying like, what I can deliver from a surgical standpoint that's going to give you what you want. And if I can't, if I'm not confident that my surgical skill is going to deliver, then I shouldn't operate on you. And I'm not the person. Maybe someone else is out there, but maybe we can't get you what you want, right? And maybe plastic surgery isn't the answer, because the worst thing you can do is have a patient, have a bad outcome that, now it's kind of irreversible in a lot of respects, right? So making sure that everyone is on the same page before surgery is super, super important. And knowing that, and being comfortable that the surgeon that you're seeing is going to be able to deliver what you want, within reason.
Yeah. And the whole, like you kind of said too, like the ethical standpoint, and it's like you said, like if, hey, like I realize this person's asking for something that's like, we really shouldn't do that. And it's like at that point you used to say, nah, this isn't, next, move on.
Right.
Because like you said, that just goes down a bad road.
Yeah. And it's, and it's hard, one of the things that's very challenging is it's hard to say no, sometimes to people because we want to help people. It's kind of like, our inherent thing is to always try to help. But sometimes saying no to a person is helping them. They just might not realize it at the time.
You're right. Yeah.
But it can be challenging because it's, patients will sometimes, and this is one of the things that I always, one of the, myths I like to try to dispel about plastic surgery is that like a lot of people, and me, one of them, right? Like I thought it was about vain people, right? And vain, rich people that just cared about themselves and what they look like, and trying to keep up with the Kardashians, right? But the more I do this, the more I realize that plastic surgery is very, very infrequently about vanity. Plastic surgery is usually about someone who is very uncomfortable and very self-conscious about themselves. There's something about themselves that they don't like. And I think it's a very challenging thing because, for better or worse, we still largely define ourselves by what we see in the mirror. And if you don't like that, what you see, or there's something, that is weighing on your mind that makes you self-conscious, it's a very difficult thing to then approach the world with any type of positivity, right?
Or confidence.
Right? And so what I find is that most patients are like the opposite of vain, right? They don't feel good about themselves, and they have something that is very troubling to them. And then what they do is they come into my office, and I'm going to talk about that thing that they don't like about themselves very in depth.
You're going to point out all the bad things.
I'm going to point it out, and I'm going to take pictures of it.
Yeah.
And I think that is a brave thing to do, right? To recognize something about yourself that you want to change. And there's also nothing wrong, I think, about doing something, and it says the plastic surgeon, right? But there's nothing wrong with wanting to do something for yourself that's going to make you feel better about yourself, that's going to give you, confidence, and it's going to make you sort of approach the world, in a better way. And that's one of the reasons that I really enjoy what I do. And there's one of the best feelings that I get is when a patient comes to me and says, I finally feel the way I've always wanted to feel about myself, and you help me do that. And I'm like, man, that's the best, and because it doesn't matter, the surgery aspect of it, obviously when a surgery goes well and there's no complications, and, from a technical standpoint, everything's perfect, that's a nice reward, right? But when a patient says, I finally feel good about myself, like I finally am rid of that thing that, I didn't like about myself, and I have more confidence, and, I interact with the world better. That's to me, that's the biggest reward. And yeah, it's one of those things that it's like the intangible thing, right? But it's
a game changer.
It's the game changer for a lot of patients. And,
yeah.
And life is hard enough.
Yeah, absolutely.
Right? Life is hard enough when you don't like something about yourself.
Of course.
So, that's why
that kind of ties into like the whole, like even mental health thing. I think, mental health is just a huge topic right now for all aspects in the world. You know what I mean? And not feeling good about yourself. I mean, that really, could, is and can become like a mental health crisis for somebody.
Yeah.
How do you think too? Like, how do you think, mental health like affects this as well?
Yeah. One of the things that was very interesting is that during the pandemic, there was a big uptick in plastic surgery. Right. And I think some of that was, I think there were a lot of factors that went into that. So number one, people had more time on their hands, right? Yeah. Because, we weren't going, people were working from home, or they weren't working at all, and had some disposable income, from our COVID checks, and we were wearing a mask. So, we didn't have to worry about bruising and all that kind of stuff. But I also, and also too, like there was a lot of Zoom calls and team calls and people looking at themselves a lot more. But I also think that there was a definite, aspect of, the world changed, in ways that we never ever conceived of. And I think that one of the good things that came out of it is that people, I think, in a lot of respects, ended up investing in themselves a little bit more, whether it was, taking the time during, lockdowns to work out. I went back and started playing the guitar more and got better at guitar. But I think that people have noticed, or I think have been more aware of wellness, I think, because we saw what unwell was.
Yeah.
Right.
Yeah. We all had more time, like you said, to really like look at yourself in the mirror or on Zoom or whatever it is.
Yeah.
And you're starting to realize like, hey, maybe I should do something here.
Yeah. And, I certainly think that, it's also kind of a double-edged sword, because once you get down to the point of where it really affects your mental health, then anything that I do for you, on the outside is not going to heal what's on the inside, right?
Right.
So you have to be in sort of that good place where, this is something that bothers you enough to come to see a plastic surgeon, right? And that's what I always say, like, obviously this is bothering you enough that you want to come and have me talk about it, but also not let it get to the point where it's like all you think about and ruminating on it and ruining your life. Because once it gets to that point, then we're actually talking about like a mental health issue.
Yeah.
And I see that, patients with what we call body dysmorphia, right? So patients that come in and like, you see this thing on my nose? Like,
Yeah, what is that? Explain that. What is body dysmorphia?
So body dysmorphia is something where people get hung up on, something that is, either like anatomically normal or something that is, like not necessarily anatomically, but the problem is so minuscule that they just focus on that. And there's really not a whole lot you can do to correct it surgically. And they just ruminate on it, and it's literally gets to the point where like what they see in the mirror is a completely different person that is in reality. And it becomes, it's a mental health issue. It becomes something that is very challenging that, to deal with, both the patient and the physician, right? Because these patients typically need like a lot of counseling and oftentimes, psychological or psychiatric help. The worst thing we can do for one of these patients is operate on them, because they're not approaching it from a good place. And then that's when you see people become surgery addicted, right? Because then, okay, well, this part of the scar was, 2 millimeters higher than the other part of the scar, and I need a surgery to fix that. And because it's a problem, not from an anatomic standpoint, it's a problem from a psychological standpoint.
Yeah, it's just a vicious cycle.
It's a vicious cycle. And so, patients with body dysmorphia, like I had one patient who came in, completely physically fit, not an ounce of fat on her. And, she was 120 pounds, fitness instructor. And she was like, I need liposuction. And I'm like, no, you don't.
Yeah. But in her mind, in the mirror, she thought that, right?
And one of these patients, because I do a lot of patients that have bariatric surgery. So they've lost weight loss surgery. So they, were 300, 400 pounds and they had weight loss surgery, and, have lost, 100 pounds, 200 pounds, but have a lot of extra skin.
Right.
And it wasn't quite body dysmorphia, but it was a patient that, I just felt so bad for this person, because they did a lot of hard work, and they put in the time, and they lost a lot of weight, and they made, so many positive changes. And, she looked great and she felt great. She had a lot of, positive health benefit from it. But she's like, when I look in the mirror, I still see a 400-pound person. I'm like, that's so sad, because look at how far you've come and,
all the work.
And look what you've done. And like, she's like, but I don't feel that way. And now she didn't quite have body dysmorphia in the sort of classic sense of it, right? But that's what people with body dysmorphia see, right? Like they look in the mirror and they see something completely different than reality. And it is something that, the outside isn't going to heal what's on the inside. Those patients can be, the worst thing you can do is operate on a patient like that without, now if they have something that's, anatomically that can be changed, right? That's a different story.
Sure.
But you still want to make sure that patient is approaching it from a good place, and, has had, proper intervention and support and all that kind of stuff. But, patients that have, very small challenges or defects is the word that we use, that is, overly ruminating or overly conscious of that's something that might raise some, I don't want to say red flags, right, but like that patient might need more help than what I can provide as a plastic surgeon.
Yeah. What about the future of technology, like AI? How do you see it? Do you see any of that like right now? You got this big smile on your face.
Yes.
You see it now, like what's it gonna look like in the future?
Yeah, so I wonder, it's a very interesting time, right? And I think that again, like anything, technology is always is always double-edged, right? It can be used for very good things, or it can be used for not so good things. And my hope as a species, like if we look back, I'm not sure that, technology is always used, for the best
Yeah,
purposes.
usually it ends up being bad.
Right, yeah.
It starts off with good intentions, right? But then everybody abuses it.
And plus, I've seen way too many sci-fi movies, right?
Yeah, right, that's right. Yeah,
I know how this ends. Right? But so AI is I think that there are certainly things that can help in medicine. The reason I'm laughing is because we do a large part of electronic medical record, and to me this is actually fascinating. They can one of the new things is helping us document, based on what the patient was there for. I don't know if it quite like listens to the conversation, because I think that there's some tricky stuff, from a patient privacy standpoint, but there's some way where it can figure out like what the patient is there and why they're seeing, and it'll create a note, documentation.
Less paperwork.
Less paperwork.
Less
right?
paperwork.
I'm all about it.
Yeah. I knew this is where it was going.
Right.
Yeah.
So, that's, and I think there's also a thing, application for it where it can help us diagnose things, probably, I don't know, better, right? But maybe quicker, based on, algorithms and criteria and all this kind of stuff.
And paperwork.
From a surgical standpoint, I like to hope that robots aren't going to replace me, but, I think that there's also, perhaps, the AI can, help me, one of the things that I always think is sort of coming, like, I wear glasses, or, like magnifying glasses in the OR, and I'm sure at some point in my life, they're going to be like what are the Google glasses, where they're, capturing stuff real time, and
doing everything, basically.
and like they're telling me like where to cut, right? Like, or don't avoid this, and this is how close like this artery is.
Little alert goes off,
right? Yeah. So, or to get like, the best outcome. This is the best. This is where the stitches and stuff are going to put. I hope it.
Because then it kind of takes the I don't know, kind of like it is almost sense like replacing you.
Right.
You know what I mean? Like, and it's doing your job for you.
Right.
And it's like, that's a weird thing.
Right. It's almost like now I'm the robot. You know what I mean? Right.
Yeah. And, you're being told what to do.
Yeah. So I hope it never I do think that there are applications where it can improve things. I think we have to also be then very careful about, the control, obviously, that we give up to things like AI, right? Because medicine is nothing if not probably the most human endeavor that there is, right? Because without humans, like, there's really no medicine, right? Like, every patient that I have is a human being, right? So, and I think the human element to that is like, you think of like the best doctor that you've ever had, right? It was probably the guy that came in and put his hand on your shoulder, right? And like, told you, I'm going to take care of you, right? You're going to be okay, right? And you take that away, and if it just becomes a cold, and it's not to say that like every good doctor, has good bedside manner and vice versa, right? But when you marry those two things, like that, those are the best, in my opinion, those are the best doctors there are, right? The guy that is smart and knows what he's doing, and will also put his hand on your shoulder and tell you you're going to be okay.
And is a rock star.
And is a rock star.
Jon Snow hair. And he's like actually like a cool guy. Like, you know what I mean?
Right.
Like,
all that kind of stuff, right?
Yeah, a lot of doctors are like boring and like, weird. And you're not.
Well, thanks. I appreciate that.
Yeah, that's why you're here. So,
exactly. But like, I always worry that like if you just make it, because robots are clinical, right? And AI is clinical, and it's cold. And, when you sort of take that element away from it, maybe we get to the diagnosis faster, but like, I don't know if it's better.
Yeah, like what's left?
Right.
Yeah, like what's there? What? Yeah.
Yeah. So we'll see. I think it's nothing if not an interesting time. But the other thing is, the thing, I just had a thought before it leaves my head, is like, the thing is, well, what now? We were talking about like who decides what beauty is, right? Now it's like the Kardashians, but what happens when the computer tells us what's beautiful, right? And it's already happening, right? There's social media influencers that are AI generated. There's art out there that's AI generated.
Yeah, there's podcasts out there that are generated. Like
Right.
there's a fake Joe Rogan podcast that is like AI just takes it and just makes up episodes based, based on, like algorithms and his previous whatever. It's like, and I've actually heard one. I've actually listened to one.
Yeah.
And I'll tell you what, man, it is like scary realistic.
Right. And and some of the artwork is beautiful. And it's like, I watched was Elon Musk, and he was in his fear of AI right? I think sort of is probably a bigger fear than what I have, right? But it's like, when you look at, well, how can AI manipulate things, right? How make up fake news stories, make up this stuff. And his thing that always kind of sent a chill up my spine is like, well, how do you know it's not doing that already? It's like kind of
Wow. Yeah, and the irony too, like first of all, Elon Musk, and like,
right, yeah, the guy that is essentially created a lot of this
pretty
technology,
much, yeah.
right?
It's like I feel like he's like leading this in the world.
Yeah.
Like, I mean, the guy's. I mean, I don't know how you feel about. I love the guy.
Yeah.
I mean, I really like him, and but it's just it's crazy to think about. Like sometimes it's like it's mind-boggling,
right?
To you, like you said, like is it actually maybe even already happening, and we just don't realize
right.
it because it's a lot of it is so good that you could be being tricked already,
right? Yeah, and we would never know, right? Because it could, like, the algorithm or whatever, like, knows what we know before we know it sometimes. And it's like it's designed to to make us hit that clickbait button.
It's
right?
It's like you said, we become the robots,
right?
It's like we became the robot, like listening to that, and we're clicking the button because it's telling us like, hey, you should click the button, right?
Yeah, it's scary, but again, I hope that we're prudent with the technology. I hope.
Yeah, for at least as long as we could be, because I feel like with any type of new invention, technology, at first it's always used for good, but then like just anything, it just gets beaten into the ground, like it just becomes something that it was never really intended for it to be. And unfortunately, I think it's kind of inevitable. I think.
Yeah.
You know what I mean?
Yeah.
Like you look at anything, like look at just social media to begin with.
Right.
Like look how it started, right? And now look what it's become, and it's probably multi-trillion-dollar industry.
Right.
It went from just being a free thing to now all it is about ads.
Yeah, keeping in touch with your friends, and now it's like the joke is like, well, my phone listening to me because I was just talking about Universal Studios, and now like everything on my Facebook page is Universal. Taking a trip. To Universal
Well,
Studios.
we'll do a true test here. So like after today, now that our phones are here, the whole world, everyone's listening, with all the microphones and stuff here. What's going to happen is I'm going to be getting all kinds of ads probably for, plastic. Who knows? It'll be a true test. I'll let you know. Like,
let me know.
I'll let you know tomorrow. Like I'll be home tonight, with my wife, and I'll be like, scrolling and be like, wait a second. I know this. You know what I mean?
Right. Yeah.
But yeah, like I believe that does happen. Though.
Yeah.
I really do. I really think that is a thing. I think it's been a thing longer than people thought it was a thing, and until it became sort of known.
Yeah.
Like people finally started kind of admitting to it, but like it's still like illegal, and I don't even know how it happens and still goes on. But
and
it's happening.
It's happening, and then how do you close Pandora's box, right? It's it's we'll see. I don't know.
Yeah.
But
I don't know if we'll know or ever know, or not. Maybe in our lifetime. Who knows?
Right.
But maybe in 50, 100 years from now, it's like.
When we all wake up from the Matrix and realize, like, this whole thing's been a simulation.
Yeah, right. Yeah, maybe it is. Yeah, maybe. What was that movie with Jim Carrey where he goes to the edge?
The Truman Show.
Truman Show.
Yeah,
I love that movie.
Yeah, it's a great one,
isn't it?
Yeah,
it's like one of the greatest movies ever. Like, I feel like sometimes, like every time I watch it, I it's one of those where you catch something new.
Yeah.
Like each time I feel like, because it's like there's so many things going on, so many things happening, and it's like, like even the ads getting served up, all that stuff. Like it's just kind of funny because it all sort of ties together.
Yeah.
And then he goes to the edge and
and prescient too. Like I mean, we're almost there.
Yeah.
With a lot of Kardashians, right? But like, it's you wonder how much, how much of things are crafted for consumption, right? And I think that was kind of, one of the points of the Truman Show is like, you end up at this inevitable, if things go a certain way, you end up with this inevitable thing where like, we are the product, right? Not the consumer.
Yeah.
Which is sort of scary.
Yeah. Yeah, it is. It is. And I forget, Elon Musk said it. I'm pretty sure it was on a Joe Rogan episode, and I can't remember. I want to look it up and watch it so bad now. But like Elon Musk actually said to Joe Rogan on his show, like, we most likely already are living in a simulation. He said that. Like he actually said, like I just Googled it because I have to know. And like he actually said that like on a Rogan episode.
Yeah, and I think I've heard that like a couple times, like about living in a simulation, and it's like I think that some people look at it like, oh, we're plugged into a computer somewhere And, you know, like I was just saying, you wake up from the Matrix and realize it's all, but I also think that there's the possibility, right, that it's not necessarily like a software type simulation, but like this, it's kind of a default, like you said, like, you know, your Facebook is influencing you on where to click and you know, go to the internet and you're bombarded with, you know, ads. And you see all, you know, we're really coming down on Kim Kardashian. I feel kind of bad, actually.
But, don't feel bad. No, don't feel bad. Yeah.
But like, you know, you see Kim Kardashian and like, this is the ideal of beauty. And it's like all of this stuff when taken together, like that's part of, you know, that's the simulation, right? It's driving us towards, you know, I don't know, buying stuff or it's a simulation in the sense that like, you know, we're influenced by so much, you know, external forces.
But who's controlling this?
Who's controlling it?
Who's
right?
controlling it?
I don't know.
What do you think? Do you think it's like another form of like, I don't want to say, I don't know if it would be considered human life, but like some other species?
So I guess the question is, does it have to be controlled, or once it starts, is it just a self-sustaining thing?
Like on an autopilot?
Yeah, like it has
thing.
no control, and it's just you know, it's a product of our own design. That's
product
just,
of our external environment. Like
right.
we're like you said it. You actually just said it. You said like maybe we created it, and we're building off of it.
Right.
Right.
Yeah.
Is that kind of what you're saying?
Yeah.
Yeah. Wow, that's
sort of
fascinating.
mind-numbing.
Yeah, it
when you
is.
think about it.
Yeah, I never really thought about it that way. You know, it's always like, I feel like a lot of people always think like, oh, like maybe there's, you know, some other like planet of people, or you know, some form of life,
right?
You know, kind of like a much higher power type, smarter. You know, you see all the UFO things that happened over the last year, which is like crazy too. By the way,
yeah,
like
I'm fascinated by that.
Yeah,
stuff.
me too.
Yeah.
It's like so bizarre, but like interesting, but like
right.
also, you know, bizarre. And they said there's supposedly like non-human life things that were found, and it's like why can't we need to know about this,
right? Yeah,
we need to know about this.
And the crazy thing is, like, I feel like that came out and people were like, yeah, okay.
Like,
this is a thing now.
Yeah.
Like, wait, what? Why isn't this the biggest news story ever?
Right, it should be. But I think it's also because I think everybody kind of has sort of believed it to a degree for so long. That finally it's like oh, kind of, well, we already kind of knew that.
Yeah.
You know what I mean?
It's no big deal.
And I guess because like no one took over the world yet, like
right, like Independence Day style.
Like that didn't happen. I think maybe, unfortunately, I hate to say it, but I don't think it won't be a news story really maybe until something like that happens, which is like wild.
Yeah.
You know, and like, you know, why isn't there more research? I'm sure there probably is, but it's secretive, and hidden from us, right? You know, from the government or whoever. But man, that stuff just like fascinates me.
Yeah, it fascinates me too. And
it really does.
And, you know, and this is like the thing, one of the things that I think is so freaky about this is that, like, to me, I always wonder, so like, again, this is like a totally like nerd thing, right? But like everyone always says, you know, the existence of life, right, in the universe that is infinite, right? They say, well, the likelihood that life exists somewhere else is, you know, it has to happen because the universe is so big and just by sheer chance. My thing has always been like, well, that's a very life-centric thing to say, right? Like, because we don't really know how common life is in the universe. That's assuming that life is a common thing in the universe, right? And it's like, you know, it's kind of like the reverse argument, like when people like with baseball, right? And they say, oh, you hit, you know, 300, you know, you missed the ball 7 out of 10 times, but you do that your whole career, you're in the Hall of Fame. It doesn't really take into account how difficult it is to hit a baseball, right?
Yeah.
Like, so to me, it was always like, well, you know, all the evidence actually suggests that life isn't really all that common, at least not that we know of. And I was always like, well, maybe the question we shouldn't be asking is, does life exist elsewhere? Maybe the question that you have to ask the universe is, does life exist? And maybe life is so infinitely unlikely that we exist to sort of satisfy that, right? And I think it was either Isaac Asimov or Arthur C. Clarke, and I guess that's like kind of the nerdy way of saying, but they boiled it down better. It was like, there's really only two options, right? Like either life exists elsewhere or it doesn't. And it's basically 50-50. And it's like both are equally possible and both are equally terrifying.
Do you have a coin on you? Should we flip it?
I know, right? But then I see stuff like, you know, so that was always the thing that sort of, you know, was in the back of my head. And but then you see all this stuff. It's like, where is it coming from? And, you know, my thing is always like, well, maybe maybe it's been here,
whole time.
maybe it's been here the whole time.
Yeah, in plain sight.
Yeah, and maybe, I don't know, maybe it's coming up from the ocean or something, and you know, because life evolved billions of years in the ocean. Maybe
and the ocean floor is like one of the least studied things.
Right.
Like I think it's like, I forget the stat, like 75-80% of the ocean floor like isn't mapped, because it's just it's too much, it's too vast, it's too deep, the whole bit, like
and most of the earth is water. So maybe we're the aliens. Right? Maybe these things are coming up out of the ocean. Like, what the hell is that thing?
Yeah, right. Yeah, wow. Oh my gosh, mind.
Yeah.
You know?
And the other thing, again, that's scary to me is that these things are always like basic geometric shapes. I don't know why that freaks me out, but they're always like spheres and triangles and squares.
Yeah, what's up
like,
with that?
I don't know. Like, because you figure, I guess one of the things they say is like, oh, these things have like anti-gravity drives or whatever, and that's why they can
zip
move
around and do impossible things.
Right. But the cool thing, like, if you had, because the reason our jets look like jets is because they have to be aerodynamic, right? But if you remove that, then you can make a ship look like whatever, like it's Star Destroyer, right? Like it can look cool, it doesn't have to be like, but these things, they're not, they're like just basic geometric shapes. I don't know why, but that freaks me out.
Yeah. And the whole geometric thing, and this kind of all ties back, this is a couple years ago, but I had another dentist on the show. His name was Dr. Steve Brand, young guy, local guy here. But his logo is, I'm going to blank out what this thing is
it's
called.
like a spiral, right?
Yeah, whatever that's called. I'm going to blank out and I sound like an idiot, but ruin the whole story. but like the point of it is it's perfect. The symmetry, like it's perfect, right? And whatever that is, it's like it's just something from like it was a fossil. Like I actually have one in my little office. So I'm going to show it to you before we leave. Don't let me forget. So at least maybe you'll walk out of here learning something and knowing something that everybody else listening right now is like, this guy's just rambling. He's clueless. but it all same thing. It was all about the symmetry and the geometry, and it's perfect. Yeah. And whatever the mathematical, I'm horrible at math. I'm sure you're a lot better at it, and so is everybody else in the world but me. But like there's a mathematical equation. For symmetry with the face.
Yeah, so it's the golden ratio. So
yes,
the Fibonacci sequence.
Oh my gosh, yeah, boy. Yeah, so I really paid attention in school, clearly, But yeah, that whole thing. Same thing with that, like how you're talking about the like the spheres, and the geometry and all that stuff. Like it's the same thing with that fossil, and all that just stems back to like the Earth. Yeah, and like it was made by, well, we don't know,
right? But
like it's like natural,
like
naturally occurring,
right?
But it's perfect,
right?
Like how is that possible?
Yeah,
and it's kind of ironic because we're talking about plastic and reconstructive surgery and perfection, and then there's that stuff. It all like ties together. Yeah. It's just fascinating.
Yeah, and it's again, I was saying before, like the cliche of plastic surgery is that it's an art, and I always like to say, well, I think it's a lot closer to architecture. Or it has maybe just as much in common with architecture than it does art. And I'm probably saying that because I actually suck at drawing, right? But it is a lot about ratios and proportions and
right, and math
and all that kind of stuff. Yeah,
yeah, it is. It's fascinating. I guess you gotta be good at that stuff to do what you do. But like all that, like it's fascinating to me, even though like I said, like I suck at that stuff. But like I like learning about it and just like hearing and talking about it because this stuff is fascinating. Yeah. It's just like you just go down this rabbit hole, and we could go on for forever, all night, talking about just that stuff. Yeah.
Well, to tie it back, one of the reasons I know about or the Fibonacci sequence, right, or the I think it's the golden ratio, is that my favorite band, Tool. Mm-hmm. So one of their songs is written with that mathematical formula, which I always thought was like kind of mind blowing.
That is mind blowing. Yeah. Wow. It's probably out there a lot, and a lot of other things we just don't even realize.
Right.
Yeah. But yeah, I'm gonna go down a rabbit hole tonight of just Googling that all night, pretty much, because like, every time I get thinking about it, it's like I just want to like learn more. Like, how, like where does it come from? Yeah.
Yeah.
It's crazy.
Yeah.
Because it's infinite.
Right.
It's infinite. That's the whole thing.
Yeah.
It's just, I don't know.
Yeah. It's one of these things that it's difficult, for like our, we're bound by time, right? Like, it's hard for a finite mind to grasp like something that big. Like you can say like infinity, but like what it's
like, what does that even like you can't comprehend it. Like it's just like but really, how, like, is it, like, I can't even think now. So, but back to back to like, your career in your industry. Like, so just, for anyone that might be listening and either, as another, surgeon, doctor, student looking to either young, old, whatever, just looking to get into the profession, like what would you recommend, for anybody, like just starting or learning or wanting to learn more? Like, where does somebody begin?
Yeah. So I think, find a mentor, right? Like find someone who's been doing it, find someone who's been doing it and still enjoys doing it.
Yeah. Yeah.
Right.
Yeah. And the right way.
And the right way. Right. So like, and again, my mentors were like so important to me, coming up. And, like I guess like Dr. Salgado, this was a guy who took a dude who he didn't want to do plastic surgery, right? And here I am, I don't even know how many, 20 years later, as a plastic surgeon. And, I think that exposure to that kind of stuff, no matter what it is, makes you make that decision more informed. And, one of the things that I really hate, right, is like, the person who's doing something but is not enthusiastic about it anymore, right? And it's like they dissuade you from doing the job that they're doing. And to me, like, and I hope I'm still this way in 20 years, but like, I can't imagine myself doing anything else, right? And like, I go to work and I enjoy it. And, I like to try to, the people who, I'm lucky enough to have, come learn from me, I tried to, transfer, I think, that enthusiasm, right? Because like when I was coming up, there were doctors that will remain nameless, but like, it sort of sounded like, dude, like, what are you doing?
Yeah, like why are you even doing this career, bro?
Right, like, and they would say, I would never go into medicine again. Yeah. Like, and it's, why would you ever want to do this? And to me, it's like, well, why wouldn't? Like, I don't know what else. I mean, I know what else I would do. I'd be playing guitar, right? But like, but like, so I think that's really important to find someone, for someone coming up, shadow a doctor, shadow a nurse. Like, if that's what you want to get in the healthcare field, don't listen, to the people who are cynical, right? Because cynicism, I think, is like the worst thing ever. But
for sure.
But because if you approach it, again, going back to things like if you approach things from a negative space, you're always going to find the negative, and no matter, you'll never be disappointed, right? But like, if you find someone that, but you still have to be realistic, right? There's challenges, and you get a lot of debt. It's a lot of school, and a lot of responsibility. But it's important to find someone that I think can be realistic, but still be enthusiastic, and still, because when you have that combination, they're more likely to teach you, and you're more likely to learn from them. Because for me, it's like one of the favorite parts of what I do is like helping the next generation come up, because like I always say, like, I'm not going to be around forever, so someone else needs to learn the right way to do it. Right. So like, I think it's really important just to find good mentors, and the people, and it's not hard to find them, because the people who want to be mentors, you'll be able to find them pretty easily. And the people that don't, they won't be a mentor. Right. Yeah. So I think that's something that's really important, and just get yourself exposed to it, because it's an investment in yourself, right? It's a long time, it's a challenge, and it's hard work, and it's sleepless nights. And, it takes a long time, for a lot in medicine, but for plastic surgery, it was, after I graduated college, right, it was 4 years of med school, 5 years of general surgery, and then 3 years of plastic surgery. So it's like 12 years of training. Wow. I say the day I graduated college, it was like I started kindergarten, right? So yeah. But going through all that, it's worth it. And if it's what you want to do, and if you're, but you can't, I don't think you can approach something like this not really being sure if it's what you want to do. And that's the thing, is you just got to make sure that you want to do it, because once you make that decision, there's no better job. Yeah. And thank God you procrastinated with that paperwork way back in the day. And you're just like, all right, well, what's left here? I know. Right? If it wasn't for that, honestly, like, I'm a I don't know if you're still a procrastinator, but I definitely am. I'm not ashamed to admit it, because I often find too, even though we procrastinate for a million different reasons. We won't go down a lot of rabbit holes, but I often find that sometimes when I procrastinate,
I still make the deadline, but I perform a lot better.
Right.
Like under that pressure of like, oh shit, I procrastinated. Like I had 7 days to do this, and now it's the 7th day, and it's due. I have like 2 hours left.
Yeah.
And it's like, boom, then I still get it done.
Well, you know, one of the things that if you wait till the last minute, it only takes a minute.
Right. Yeah.
Right?
Yeah. Like what they say, like if it takes, only takes, if you give yourself 10 minutes to do something, you'll get it done in 10 minutes. Like it's the same thing, or it's like, same thing with cleaning your house. Like until you have like somebody coming over, like you never clean that well or at all.
Right.
It's like, oh crap, someone's coming over, quick, clean up. And you're able to get the house clean in like 30 seconds.
Yeah. Like I still procrastinate, but it's more with housework, right? It's like,
definitely.
when my wife, she's, when this comes out, she'll get mad, but like, she'll tell me to do something and then I'll play like video games.
Yeah.
For
and you'll be like,
4
I'll be like in 2 minutes. You just keep saying 2 minutes.
Right. And then, if she gives me a task to do before she gets home, then I'll wait till, she calls me, I'm on my way, and then I'll get it done.
Yeah,
but it's done. It's done really well.
Yeah.
But it's just done at the last second.
Yeah, exactly. And there's nothing wrong with that. Like I would just say, hey, as long as you get it done, But I often find the procrastination sometimes ends up being a good thing.
Yeah. Yeah. I mean, you need a little bit of healthy fear.
Yeah, pressure and stress, and it's like perform.
Yeah, exactly. Exactly.
So, but next time we'll have you on. We'll put some face paint on. We'll
we'll rock
bust
and roll.
out some tunes.
Yeah.
We'll bring back the band. What'd you name the re-up? The
face transplant.
Face transplant.
Yeah.
I really like that.
Yeah, because you rock so hard, you melt. It's face melting. Right.
I love it. I love it. Well, this was great. Really, I appreciate you coming on.
Thank you very much.
And,
I had a blast. Thanks for having me.
Yeah. Next time it's going to be rock stars and aliens.
Perfect.
I think. Part 2. Because we touched on it a little bit here, maybe even more than the plastic surgery stuff.
Yeah.
But interesting stuff. I hope people didn't mind my rambling of the golden ratio that I just know like the basics about, and hopefully,
it's all good, man.
Yeah, this was fun.
Yeah, I had a blast.
And shout out to Jarrett, by the way.
Yeah,
Jarrett Ferentino.
Ferentino.
I mentioned this, but I didn't say his full name before, so a shout out to him for connecting us.
Yeah, this is great. My brother-in-law extraordinaire.
Yeah, I told him, I said, I'm always looking for my next best guest.
Right.
Whenever someone's like, hey, like, do you need any recommendations? I don't know if he asked if I needed them, but I just said like, hey, like, could you have some? And I always tell everybody, like, when somebody asks me, I'm like, I say, hey, do you looking for anybody for your show? And my response every time is, I'm always looking for my next best guest.
That's right.
Right?
That's
so of course I am, so, but yeah, shout out to him honestly, that is where all the best guests of the show come.
Yeah.
Like most of the time now, it's just like, everybody always asks me, like, how do you find the people like for your show? Because I have just and I'm sure you've probably seen it, I have such a range of people. Like from one episode to the next could be like totally different. Like totally, like not even in the same, atmosphere, right?
Right.
And everybody always says like, where do you get some of these people? Like they're so interesting and fascinating, blah blah. And I'm just like, my guests, like
right?
The people that are on the show.
Yeah.
It's like they walk out of here and they're like, "Yo, I got somebody for you." So, no pressure.
All right.
No pressure. Procrastinate on it.
Yeah. Let me think about it. Wait till the last second.
Yeah.
I'll come up with something.
Yeah. All right. Dr. Chris Sanders on the Stacks podcast in the Blue Door Studio. Thanks for joining me.
Thanks, man. Glad to be here.
If you want to see more On the Stacks content, subscribe to our YouTube channel at youtube.com/onthestackspodcast or search the hashtag OnTheStacks on Instagram, Facebook, and LinkedIn.